medication price, and now we're paying 71%, right? Whereas the member, if you notice there, used to pay maybe 17%, but now they pay only 5% for those drugs. So still very, very low cost for our members. Some of the changes and highlights I can talk about Part D is there is going to be a coinsurance in tiers 3 to 5. There is a video that explains coinsurance in Jarvis, in Learning Lab. So please go in there and view that video. It's really helpful. We also cover vaccines. Vaccines are at 0, and the vaccines don't require a deductible either. So if you notice, Part D covered insulins will continue to be at 0 in our chronic plans and $35 in our regular plans. And whenever insulins are required, our members don't pay that deductible. Medicare Advantage prescription. So we have a Medicare Advantage prescription drug, right? But we also have a Part D separate plan, right? So because we have an individual Part D plan that's available, however, it's non-commissionable to agents. So I did want to talk about the standalone Part D a little bit, just to let you know that because we still have that Part D, we are able to reduce a lot of the tier 5 to tier 4. So that really allows us to be, more cost effective in front of our clients. So we're adding new medications to coverage. We're also adding and adjusting anything related to step therapy. Maybe some medications will require a prior authorization, I gotta say, and removing some of the formulary medications, like, I don't know if you guys have heard, but Prolia is now Jubbonti, okay? So all of this information, you can find it in Jarvis by going into Knowledge Center, click on Reference Guides, and going to Part D changes. All of the changes on any type of medication. What's good about that Prolia is that our members will be able to just go into the pharmacy and receive Jubbonti now without a new prescription, which makes it very convenient. Yeah, and the drug cost estimator is there because there is going to be the need for you to ask your client, hey, so if that medication is no longer covered, now there's a new alternative drug that you can take, right? And here are the drugs. And you're gonna sound very knowledgeable, equipped, right? And confirm which medications they're able to take, because the drug cost estimator, if you haven't used it before, it's in Jarvis as well. You're going to be able to type all those medications, and it's gonna shoot out what medications are an alternative medication for your client. And also LIS status, if you are able to put their LIS status there, right, you can click that and it's going to give you the amount that the client actually pays for that drug according to their level of LIS. So don't forget that the members are able to not reduce how much they're gonna pay throughout the year, but they're able to have a payment plan that can be distributed amongst 12 months, right? So they're able to, to me, it's more cost effective when they do that, because the members then they're able to afford, right, a monthly instead of just paying a full deductible or a coinsurance the first month of the year. So in January specifically. Just so you guys know, whenever our members need to take a new drug that is very expensive, they get a call from United Healthcare to get them into this M3P program, and we're able to give them that opportunity so that we make their medications affordable. And prescription drugs, has changed, right? The monthly premium for the Saver went up to $109, and the prescription for the PDP in the Prefer went to $165. So notice how the premiums are increasing year over year, right? And there's a reason for that. We continue to see that, it is a very reduced deductible, very reduced co-sharing that our members have to have, but we're still trying to keep it affordable for those members. Medicare supplements, require a prescription drug plan, right? And we understand that. But Medicare supplements are still really popular. And why is that? Because our members are able to see any doctor throughout the United States that accepts Medicare. And they also don't need a prior authorization or a referral to go see a doctor. And the coverage is guaranteed renewable, which means that they can continue to have it no matter what happens to them. Now, we know with the PPO being terminated, and I can say that because you guys, if you haven't been to the Medicare product portal, where we put all of our plans there, you can see the comparisons for LA County. So LA, OC, San Diego, and any SoCal PPOs are no longer going to be in 2026. So because they're terminating, we want to make sure that you understand how the Medicare supplement works, because that might be an option for them. However, right, we want to ask some of the questions. Why should they choose United Healthcare? Well, one of the things is we're the #1 provider of Medicare supplements. We average about 10-year tenure with our members. Our members stick with us, and 96% continue to choose United Healthcare. Now, the plans are available nationwide, and they're also portable. If that plan is available here, we automatically